Hi, my name is Michael Blackwell. I'm the director of the program for pet health equity at the University of Tennessee. It's such an honor to be with you today to share some thoughts around our work, all of us, and what we're doing to bring about a stronger community, a healthier nation made up of healthier families. I'm going to talk a little bit about equity, uh, One Health, and sort of the way forward as we see it in order for us to all thrive. Together we thrive. Inequity is a target of our work, primarily inequity in veterinary care access. We know that when families don't have access to veterinary care, it really traumatizes them in many ways, ultimately breaking up the family too often because the pet dies prematurely or needs to be relinquished to a shelter in order to get that care. The family doesn't want to lose their loved one, but they're willing to make that sacrifice if it means saving their loved one's life. Um, those who work on behalf of families or the pets of families, whether you're in animal welfare or veterinary medicine, we're also harmed by the conditions in which our communities exist today, with so many families struggling to access not only veterinary care, but other essential services. And so the question of what are we going to do about that is an important one. It's the theme of this conference, that is working more collaboratively. And I'd like to just touch on some key principles that I think are important as we go forward in our collaborative work. Let's start by saying, at least I do, that there's still fragmentation in our systems. Why are our systems fragmented? Well, first of all, especially with human health care, social service, it's complex. There are lots of programs, lots of funding streams, and other resources, and diverse disciplines involved in supporting families. It's further fragmented by the fact that veterinary medicine and animal welfare are not as integrated in the larger community of family support systems. And that's work that we can address. That is becoming better connected, better integrated in order to do a better job of reaching the pets that we want to reach. And I am being very specific at this point in this presentation about pets as opposed to wildlife and many of the other important animal species. Why are these systems fragmented? Well, most of the programs and systems were built in the 20th century with just humans in mind as who makes up a family. We go back far enough, and while pets were amongst our families across this nation, there were not nearly as many that were living in the home and viewed as family members. So when the programs of the 20th century were built for that society, of course, they didn't see the pets, didn't include the pets in that planning. Our 21st century society, where 7 out of 10, 2 out of 3 of the households, let's say, have pets, the majority of which consider the pets family members, we ask ourselves then, are the systems that support these families, and especially those who rely on various forms of assistance, are they aligned for the families of today? And I would say no, because again, they did not include pets in the programming, the planning as these systems were built. That's work, real work that we can be about in bringing about a stronger, healthier community. So that's the problem that needs to be fixed. And part of that fragmentation is who's paying for what. what things get paid for and why. And when we look at the big pot of resources available for humans and for families compared to that pot of resources for the non-human family members, the pets, then our strategy should be, how do we gain access to that larger resource pool? And that is doable, but it's doable by us taking a family-centric approach to our work. And let's be clear, a family might be an unsheltered family, someone who lives on our streets, that's homeless. That's still a family unit, and should be viewed that way. So the word equity is more and more being discussed in our industry, and I'm very happy about that. We started to make a point about health equity years ago, and everywhere I go now, I'm hearing people use that term, and that shows progress. That shows we're well underway in getting to where we need to get to. But let's just, for those who may not be familiar with the term, just define what we mean by it. On the left side of this image, the green bars represent the programs, the systems that support families. And one can build these programs where they treat everybody equally, irrespective of anything else. You're going to get the same treatment. And you know, for many things, there's a lot to be said about equality, treating everybody the same. But in reality, we know our families are not equal. They don't have the same resources, the same education, not living in the same kinds of neighborhoods, and on and on and on. And so we know that there is diversity. And equity simply means that as we build programs to support these families in our communities, we adjust the programs according to the needs of the family. So an easy one would be, if we have a most awesome program for supporting families, but that program only communicates in English, yet it's operating in a community with a large Spanish-speaking population, that's an easy example of an adjustment that's made. You actually translate your materials into Spanish. You have people who are part of your organization, part of the system, who speak Spanish in order to reach those Spanish-speaking families. When we think about who they are, what do we mean by who they are? The people we're trying to help, the families in our community. What's the cultural makeup? Then we start to back into looking at our mission and how we carry it out, and are we aligning our efforts in a way to meet those families where they are? That's what equity seeks to do. And it's a very important way to go about our work. All of you've heard of One Health. It's another phrase that's used very often now. And sometimes people are throwing in one welfare, one health, one welfare. Well, I'm going to stick with One Health here by just simply saying One Health is a simple framework that says no matter what you're trying to work on in your community of import, and especially as it relates to health and well-being, it's important that you think about the people in the picture, the animals, and again, I'm being specific about pets here, and their shared environment. Where do they live? How are they able to get around? What is the housing situation? What's the income, average income levels for their households? By looking at that total picture, we start to now see where the gaps are in service, or where we need to align our efforts in order to better reach those families. So this is an image we sometimes use when talking about aligned care, a system intended to improve access to veterinary care. And what we say is, in order to get a family in need that needs assistance to the veterinary service providers who really want to help, it requires a systems approach. And that system is factoring in, again, not only that the pet of that family is ill or injured and really needs to see a veterinarian as soon as possible, but the people, are they able to get to the vet? Do they have language barriers? Are there cognitive challenges? And then, of course, what about the funding? Do they have the resources? What can they pay for or not pay for? So looking at that whole picture enables a program to be built that adjusts for the realities of these families. And I'm simply saying, thriving together, collaborations that will yield better outcomes means we're thinking more holistically in a One Health sense with the intent of achieving equity. So as we piece together these new alignments, building new teams, new collaborators, organizations that are now communicating on a more consistent, predictable basis, then there are some specific things that we can start to look at, and they are captured in public policy. And I'm using that term in the broadest sense. Public policy really means, what are the rules by which we go about doing our work? What are the rules of engagement? When this happens, we do that. When that happens, it means this to us, and that triggers the other. That's what public policy actually looks like in practice. Sometimes it involves laws or regulations, but a big part of it is what organizations choose to set as the way they're going to set as rules by which they go about carrying out their mission. When we think of how do we fund this work, I touched on this a moment ago. If we don't have adequate resources within our industry, within animal welfare, within veterinary medicine, well, then where do we go to find that additional funding? And I'm saying there's a huge pot of funding in this nation that is not by design lined up to support the work that we do to reach pets and support the families that are underserved. That means developing relationships with new foundations, new types of organizations, new in the sense of not being traditional in the work that you've done previously, building new teams. So new collaborations are what also brings along the new streams of funding, the new access to resources that were not there before. This cuts across multiple industries, these collaborations, and integrating efforts so that we know we want to improve access to services for families, support those families with providing the services that they need, but recognizing, well, I don't have to be the one who has to wake up each day and be all things to all people, try to do it all. Who is it that does similar work that's needed for this mission that I'm carrying out, that I can build a relationship with, who's going to carry out that part of my mission? That's when integration of services start to really happen, and we have fewer and fewer gaps as far as reaching the services. There is a need for regulatory reforms because, again, most of the systems and programs that operate in our communities today were built in the 20th century, targeting families that were just humans and not incorporating the presence of pets within those family units, those family systems. Our 21st century society are bonded families. They have non-human family members. And so whether it's through regulatory reforms, just sheer public policy changes, we start to adjust um, those rules of engagement so that now we are factoring in the presence of the pets. Now, the people attending this conference say, well, yeah, that's what we do every day. Yes, I know, and that's a great thing. What I'm saying is we need to develop um, methods of educating other stakeholders. They don't know they're a stakeholder in the sense that we're talking about, but who's going to inform them? Who's going to help them to understand how their mission gets improved by integrating in strategic ways with your mission? That's real work that can be done. It's being done by My Dog Is My Home and other organizations. We're among them. We need all of us to be in this space to actually start to pull these integrations together. And what comes out of that then would be what we like to call an aligned community. The infrastructure, the essential services are aligned for the society we are today. That is a bonded family society, a society where pets um, are present and influencing outcomes either positively or negatively. Together, we thrive by aligning resources, synchronizing efforts, and prioritizing essential services. Not everything has equal importance. Let's do the hard work of figuring out first things first. What's the most important work to be done or task to be completed before we move on to another? Being clear-headed about how your organization goes down that road to improving your effectiveness, understanding that going down the road we're talking about here, or at least I'm presenting, involves these new collaborations, these new integrations. And to wrap up, I would just simply say, I'm so optimistic that we can build a world where every family, regardless of their background, can enjoy the love, the joy and companionship of their pets.